Bringing a smile to your face is the goal of an entire team for one local dental office, as Joe Cronauer discovered recently. Check this out.
We are so glad to spend some time with our friend and dentist, Dr. Stephen Marsh, who's spending a lunch hour with us today. Doctor is joined by his team. It's good to see everybody.
Hi. Hi.
And Joe, I need to point out, as part of our team, because it is lunch hour, a couple of them have already started the lunch, but they were nice enough to come in and help us this afternoon.
Well, introduce everybody you have behind you, Doctor, real quick.
So excuse my head. So we have Debbie, we have Karen, we have Alicia, and we have Amy. And as I said, that's part of our team. Joe, they average between us, I'm not saying they're old, but we average 30 and a half years of dental experience between our entire group when our entire group is together.
That's wonderful. Wonderful. It's great to see everybody. You know what? And they've been there a long time, because I know that you and your team arrive every morning, Monday through Friday at 6:45 a.m. Doctor, why do you start that early in the morning?
So, Joe, one of the reasons is every morning we have a team huddle, and everybody's with me, and we sit around, social distancing, and we talk about who's coming in that day. So we're very prepared for each patient. We also go over their medical history, if there's maybe diabetes, any sort of heart problem. We'll also go over the patients who were in the day before. Is there anybody we need to follow up on? We also take a quick look at who's coming up in the next day or two or three, so that we're ready for them. If there's lab cases that have to be readied, we're all prepared for their arrival. And it's one of the most important parts of our day, so that when patients come in, we know what we're planning to do. We know what their response is going to be, and we're primed to get ready and go and give a little speech, a little team spirit, and we get ready for our day.
Well, it obviously shows in the work you do. So what do you say we take a look at you and your team in action? Let's take a look at some of the folks that you've taken care of just this past summer. Who do we have here?
So this is Lisa, Joe, and about 6 weeks before her wedding, her mom and Lisa came in, and she wanted to change her smile again. You couldn't do braces within 6 weeks. So we talked about doing some porcelain veneers. We did a setup to show her what we thought we could accomplish. We did 4 porcelain veneers. We did some lower reshaping, and her wedding day was beautiful. It was before the COVID, so everything went well, but she was very thrilled with the result, as you can imagine.
Beautiful, 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 beautiful bride, I'm sure. Very nice. And who's this?
So this is Marcia, and Marcia had a crown done many years ago. You see, over the years, her teeth had spaced. Same sort of thing. The color was off on that crown. She wanted the teeth to be uniform. She didn't want space where she was catching a lot of food, which often happens as we mature and our teeth shift. So we were able to do, again, one crown, rather, Joe, 3 porcelain veneers. We did some reshaping of the teeth and gums, gave her a perfect smile. And I would also add that when we were done, we also made her a retainer, because, as I suggested, as you get older, teeth will shift. We wanted to, now that we've gotten a wonderful result, we wanted to maintain the look that she had.
You know, speaking of retainers, Doctor, I think the days of, well, I'm just going to need braces. Obviously, you can fix spaces without braces.
Yeah, and sometimes we can, and it's a great point that you make. Some people, because of gum disease, it can be some bone problems. We have to do it conventionally, more like this. Other cases, we can still do it either with retainers or aligners. So there's still a certain value in it, depends on the age of the patient, and again, their bone and gum condition.
Awesome insight. Very good. All right, now this is Norma, correct?
Yeah, Norma actually had some teeth that she wanted to be veneered. She wanted to have an upper look that was bright and beautiful.
Talk about bright. It is brilliant. It's so bright. It's gorgeous.
Well, we have a choice of colors. Or shades. We didn't always have that, Joe, but dentistry has moved to a brighter look, a whiter look. So we did porcelain veneers on the upper. In the lower, she actually had a partial that went in and out. You can remember those sort of old school restorations. You can see the metal if you look closely. We were able to restore it with a new type of partial, has no metal. It went in beautifully, reshaped and bonded the front teeth. And that combination gave her a much more youthful look.
Now, I love these. I can do this all day, but we only have time for one more. Who's this?
So our last patient is a young woman named Lee. She had braces. You mentioned braces. Again, teeth shifted. She didn't wear a retainer. She's in sales, wanted to be presentable. And so we did 4 porcelain veneers and whitened the other teeth to give her a wonderful result in literally 3 weeks' time. And I just saw her the other day, and she said, "I still love my teeth. I get compliments all the time."
Well, you know what? If you want to see Dr. Marsh and his team in an upcoming day, please make it a part of your day and get that smile to where you want it to be. It's so simple. 440-461-1003 is the phone number. And the website is so easy too, and it's a great website, clevelandsmiles.com. Doctor, thank you so much. It was great spending time with you and your team.
Thanks. We all appreciated your visit today.